Welcome to PRISM, our approach to collect and use patient-reported outcomes to amplify the voice of the patient and provide an avenue for patient engagement outside the clinical encounter. Our app fosters patient engagement by giving patients real-time feedback of their measure trends and where they fit in the overall population. The platform supports patient-reported outcome instruments and seamlessly integrates with EHRs. The PRISM app allows patients to quickly fill out surveys easily and conveniently. It includes friendly SMS reminders. The app provides patients and their physicians with meaningful, timely feedback, presents comparisons of how they are doing to other patients, and allows for follow-up assessments and tracking of results over time. Patients receive relevant recommendations and education to further engage them in their care. The app can be easily extended to capture other types of structured data for other patient-reported outcomes as well as supporting research. PRISM provides a platform that can support interaction between patient and provider in between visits and help engage the patient in their care. Security is a critical aspect of any patient-facing application, and it has been engineered into the PRISM app from the start using OAuth 2 and SAML for authentication. First, patients must go through a secure registration process initiated by their doctor's office. An office admin sends an SMS link to download the PRISM app to the patient's phone while they are in the waiting room. This associates the phone with the patient and is a second factor for authentication. Secondly, the PRISM mobile app ensures that no protected health information or any of the PROMIS answers are stored on the phone. They are only stored on secure PRISM servers. The PRISM application and data are stored on secure HIPAA-compliant servers hosted at Amazon AWS. The answers to the PROMIS questions are also sent securely to hospital or clinic servers in real time. The app can send the data in the JSON or XML formats to an FTP server, or it can send the data to an EHR using the FHIR Structured Data Capture API for patient-reported outcomes.
Hi, how can I help you?
Hi, I have a 9:30 appointment with Dr. Smith, last name Kim.
Okay, I have you all checked in. The nurse will be back shortly to take you to the exam room.
Thank you.
While you're waiting, we have a few surveys for you to fill out. If you don't mind scanning this QR code to register your account and to fill out your first survey. This survey will help us understand how your medical conditions affect you over time and report how you're doing between visits.
Well, how are these any different from the paper surveys I fill out?
Not too different. We're now using a PRISM app that makes it easier to collect and use this information. This allows you to quickly fill out the surveys and track how you're doing over time. We will appreciate if you could do it before you're seen today, and then when you're back with your doctor, he will talk to you about how often to fill out the surveys and if you need to fill them out between your visits. Questions?
Seems easy enough. How long will this take? Will I finish in time before I'm called in?
Well, you have plenty of time. It only takes a few minutes to register and fill out the survey. If you have any questions, you can come back and I'll help you through it.
Great, thank you.
You're welcome.
When a patient scans the QR code at their clinic or visits the link provided, they're taken to a web page that makes it quick and easy to create an account. The first screen they land on gives a quick overview of what they can expect out of the experience and highlights the most important value drives to the patient based on our extensive patient interviews. They're then taken to the authentication provider where they can securely log in using their familiar Epic or Cerner account. Once this step is complete, the patient lands directly on a page describing the survey they're supposed to take and then immediately into the survey itself. We designed the survey experience to be as distraction-free as possible. But in our testing, we found certain PROMIS assessment questions created confusion in a subset of patients, so we also included a help option. One of the biggest barriers to PRO adoption we identified was usability, so we created several iterations of the survey experience, testing even the specific animated transition between pages to maximize the ease of use and ultimately the patient's comfort with the application. Once a patient has completed a survey, they're immediately presented with the results. Here again, we tested many iterations with patients to visually represent the results in a way that's highly intuitive but also compelling. At this point, we suggest to the patient to download the mobile app. From our data, we found it's extremely important to offer patients the option to participate both through web or through a downloadable mobile app, since their comfort and preference of these two options varied widely. PRISM was designed to go beyond a single use and provide more value to patients and providers by seamlessly collecting follow-up PROs. So when it's time, patients are notified of new requests for surveys by text message, which we found to be significantly more effective than any other medium. When a patient receives a text, a link takes them directly into the app where they can log in, if needed, and quickly complete the questionnaire. The PRISM app can be adapted to handle multiple surveys, computer adaptive surveys, and short-form surveys. It is also highly secure and designed to be HIPAA and FHIR compliant. In addition to providing clear results to a single survey, we found many patients really want to be able to see how they're trending over time. So we built in notifications to clearly show how their score had changed since their last assessment. Next, patients are taken to their home page where they can explore the rest of the app's current functionality. They can see at a glance trends for one or multiple types of surveys, content, and navigate to their settings. If a patient wishes to dive deeper into their data, here they can dig into their stats and receive contextual feedback based on people similar to them. Patients can also receive personalized content. We found some patients were most likely to respond to content framed as patient stories because they found it relatable, while others gravitate towards traditional health information content, so we created a system that can adapt to both. So far, we've received strong feedback from patients that the PRISM app is very easy to use even for elderly patients and ones whose level of technology comfort is low. We've also received feedback from clinicians in multiple specialties that the functionality shown here would be valuable in their practices. The PRISM app allows patients to quickly fill out surveys easily and conveniently. It includes friendly SMS reminders. The app provides patients and their physicians with meaningful, timely feedback, presents comparisons of how they are doing to other patients, and allows for follow-up assessments and tracking of results over time. Patients receive relevant recommendations and patient education to further engage them in their care.